Hello, everyone. We are a team of researchers from Penn State Media Effects Lab and the University of Southern California. My name is Yuan, and I would like to share with you our study on how health recommender system based on social media can affect user trust. The use of scalable digital health interventions has the potential to significantly enhance the efficiency and accessibility of healthcare. However, the vast amount of user data scattered across different sites presents significant challenges to delivering highly relevant information to users, thus giving rise to health recommender systems. Currently, there are three commonly used personalization approaches. The first approach is demographic filtering. For example, some healthcare recommendations provide motivational information that is tailored based on users' age and gender. Some health recommender systems apply content-based filtering, such that matches items based on users' own workout preferences. Other recommender system uses collaborative filtering and provides recommendations based on data from similar users. However, these recommendation systems often struggled when there is limited user data, known as the cold start problem, and infer user preferences based on implicit user relationships rather than actual activity. In these cases, social media networks can provide additional information about connections among users, thereby leading to more reliable and accurate recommendations. Different from the traditional types of approaches that rely on obtaining user data from their activities on a website, in recent years, online recommender systems have leveraged the power of social influence for promoting healthy behaviors. The prevalence of social login has also accelerated the process of user profile building by granting web application providers access to users' social network credentials. Is this a better way to provide health recommendations? Existing studies have shown that recommendations may trigger negative outcomes if users perceive that a recommendation algorithms filter out or suppresses certain social identities. And users are very sensitive to their social media data. All these could potentially trigger resistance to behavior change. In fact, users may have their own preferences regarding how their personalized recommendations should be generated, while in reality, users often have no such freedom to make a choice, but rather to accept the system-assigned algorithms. Currently, there still remain a lack of understanding of how different personalization approaches differ in their persuasiveness for health recommendations and how they may elicit negative reactions from users. In addition, what are some design mechanisms to overcome such negative reactions are limited. To examine these questions, the study follows the theoretical framework of high time. It proposed two theoretical routes. The Q route examines how specific interface cues of an AI system can trigger quick judgments about the credibility of the system. For example, a recommender system interface indicating that the recommendation is based on popular choice of other users may trigger the bandwagon heuristic, or if others think something is good, I should think so too, which leads to positive user perception. The action route, on the other hand, affects user judgment by affording users the ability to engage with the system. For example, user can change the system settings or make different choices to affect how the system works. In our study, we designed a prototype website named MyFitness for recommending personalized fitness plans. And there are two types of user data. One is in-app data, another one is social media data. For in-app data, the recommender system used the answers to the questions users have provided, such as users' fitness preferences and demographic information. For social media data, users log in through their social media accounts, and the recommender system told the users that they will receive recommendations based on their social media information. We designed a 6x2 between subjects online experiment. And we provided 6 different personalization approaches, which differs from the source of data, which is in-app or social media, and different approaches of personalization. We also designed a user choice button that users either have the options to select from additional personalization approaches, or they don't have such choices. So in our study, half of the participants were randomly assigned to the personalization condition with this user choice condition, while the other half do not have such option. By the end of the interaction, participants received their personalized fitness plan, which we designed from Department of Health and Human Services. To avoid the confounding effects, they received the same recommendations across different conditions. To manipulate different personalization types, what we did is we embedded different explanations that the respective system presented to users. For example, if it is the in-app content-based filtering, the system will say the personalized workout plan is based on users' own preferences for the type, intensity, and frequency of exercise. And for social media collaborative filtering, the system will say that the workout plan is based on what the user's social media friends have viewed and liked on social media. And such manipulations appears 3 times on the home page, loading page, and result page. We first examined log data from user interactions with the user choice feature to understand how users switch among different algorithms. And we find that 67.5% of the participants switched to another personalization approach, while 32.5% chose to stick to the current approach. Meanwhile, while users have the choice, most of the users choose to switch to generate their fitness plan based on their own preferences, while users chose social media-based recommendations the least. Our data further shows that collaborative filtering using social media data lead to the highest level of perceived threat to identity, while content-based filtering using user fitness preferences lead to the lowest level of threat to identity. Through mediation analysis, we also find that personalization approaches using social media data lead to greater perceived privacy risk and thereby lower user trust. Collaborative filtering based on social media, such that based on what your social media friends have viewed and liked, score the highest for perceived privacy risk. In addition, we find that providing user choice can enhance users' sense of agency and mitigating sense of perceived threat to identity, which enhance user trust. Such effects were more profound for users who were assigned to the social media collaborative filtering condition. We also find that the main effect of user choice on usability was not significant, indicating that user choice does not negatively affect usability. We also gained some insights through open-ended questions regarding how users think of social media-based recommendations. Multiple participants indicated that data derived from their social media activities would not accurately reflect their unique health needs. For example, one participant mentioned that we all hit like on things we don't care about, and that could skew the effectiveness of the algorithm. Several participants also mentioned another limitation of such approach. If they don't have enough fitness information from their searches or viewing of social media to generate a proper fitness plan personalized to them. In relation to perceived privacy risk, several participants voiced concerns regarding social media data use, and they also mentioned that it will negatively impact their friends. Taken together, our study demonstrates that providing recommendations based on social media may backfire in the health context by posing a threat to users' sense of identity and raising privacy concerns. Therefore, current practices that are embedded in social media feeds, such as your friends recently liked this post, may not be an effective way for encouraging healthy behaviors. Our study calls for careful evaluation of user perceptions when implementing social network information into personalization algorithms. Potential design implications including incorporating interface cues such as based on your unique preferences to boost users' sense of identity and improve their user experience of the recommender system. This study also reviewed the positive effects of providing user choice, enhancing users' sense of agency, which in turn enhance user trust in the system. For details, please refer to our paper. Thank you so much for listening. Please let us know if you have any questions or comments.